Well, as 5 to 11-year-olds in Ontario are now getting their first COVID-19 vaccinations, a new strain has been developing in southern Africa. Infectious disease doctor Zain Chagla joins us now with more. So let's start off with this new strain in Africa, because I understand it's spreading rapidly among young people.
Yeah, absolutely. So, the South African Genomic Surveillance Network recognized this and raised the alarm a couple of days ago. There's a lot of cases that have been spreading, particularly around the Johannesburg region in younger people. Now, it's not clear totally if that's just a reflection of who is the initial population, the population getting COVID-19 at baseline, or if there's something particularly here. But, there are some characteristics and mutations on this virus that make it a little bit more concerning for things like, breaking through natural immunity, or even, potentially even breaking through some of our treatments. And so, this is something that the world does need to know, and cases now have been identified as far out as Belgium and Israel. It's likely not just from South Africa. South Africa is the one country that's able to do this surveillance, but it may be from somewhere else in sub-Saharan Africa that this derived in. But it's a lot of concern, and I think a lot of us in the community have been calling for equitable vaccine strategies, and unfortunately, this may be one of the consequences of not paying attention to it.
Right. So are these cases that kind of seem to start in southern Africa, are they among unvaccinated people then?
Yeah, it's still unclear epidemiologically. The one thing that they have is that they're able to test for them really quickly using actually the same test we used for the Alpha variant back in December of 2020. They're able to go back and reclassify some of those cases really quickly, but they still have not done that epidemiologic analysis, say who's been infected, why are they infected, what's their immune status, what's their vaccine status. There is a single traveler that is fully vaccinated that's been described in Hong Kong that has been one of the cases, but again, it's not clear whether or not that's just a breakthrough case, or that's more other piece of vaccine waning in that sense.
Okay, so does this variant, does it have a name yet?
So it's right now B.1.1.529. It is going to the World Health Organization. I presume they will call it the next Greek letter, which is Ni, or Ni, N-U, but pronounced N-E-E. And I think that will likely be announced today after their meeting.
Okay, so let's get back to the news in the province then, because the province says that the child vaccines for the 5 to 11-year-olds, that's going to be a game changer in the pandemic in this area. How important is this vaccine rollout to you?
Yeah, I mean, look, there is a susceptible population, and we have kids that need to go to school. We have kids that need to play sports. We have lots of interactions between kids in the community, particularly immunocompromised and vulnerable individuals, elderly individuals. This is good news, right? It means that these vaccines can be offered to more people, especially as we see this global instability in terms of variants. We know that vaccines have worked against every variant to this point, and so giving everyone as much protection as possible is going to help. We are 75% as a population immunized. Hopefully, if the kids come out, we get to really, as a full population, not just an eligible population, 80 to 85% of our population fully immunized of everyone, which is a good sign for us long term. But also a good sign for our healthcare system that they likely will not have to deal with significant burdens and what we saw back in March and April and February of this year.
Right. Now, how does the virus affect children in that age? Does it affect them differently than older children or adults?
Yeah, the good news is the vast majority of children do much better with COVID-19 as compared to adults, and we see a mortality gradient that goes down with age. But we do see kids that end up hospitalized. We see kids that develop what's called MIS, or multisystem inflammatory syndrome, which is an autoimmune response that can be fatal or make kids very seriously ill. And we see, complications from long COVID in kids. And so, there is still a need, even in the mortality piece, there's still much more mortality here than other of our vaccine preventable diseases in children. But from a long-term stability standpoint, from prevention of these complications standpoint, there still is a rationale to vaccinate kids right now.
Alrighty, thank you for your insight, and we will keep an eye on that knee variant and what the WHO does with it today. Thanks very much, Dr. Zain Chagla.
All the best.